On this episode of the Ask Mike Reinold Show, we talk about squatting with knee osteoarthritis. We talk about the difference in rehab between baseball players and football quarterbacks, and we talk about the use of ice for pain and inflammation.
The Ask Mike Reinold Show. Helping people feel better, move better, and perform better.
Welcome back, everybody, to the latest episode of the Ask Mike Reinold Show. We're up at Champion PT and Performance up in Boston, Massachusetts. Mike Scaduto, Dan Pope, Dave Tilley, Lenny Macrina. It's been a while. There's a little gap in episodes. I don't know if anyone noticed. Nobody probably noticed.
I did.
There's a little gap. We were recovering from the summertime here, so we had a little bit of gap in our episodes. Actually, I met somebody in Chicago. I was speaking at a meeting this weekend, so hopefully you're listening. But she just told me, she's like, "Oh, hey Mike, I just wanted to say hi. I've listened to a couple of episodes," and I was like, "Oh, that's great. I think we have like 150 though. Like you've only listened to 2 of them." Oh, so I gave her a little crap. But we're here with another great episode. We have some good questions coming up from our students. 2 new students to introduce. First, we'll start on the left.
My right?
No, it'll be the right.
Your left.
What would it
Stage right.
Wait, what would it
Stage
be?
right. Stage right.
But on camera, it's left.
Yeah, it's their left.
Still like on YouTube,
It's their left.
you're on the left.
YouTube left. That's right.
Alicia Arcangelo from the University of St. Francis College of.
University.
It's just St. Francis University.
Yep.
I'm so
That's
bad.
elaborate.
I'm so bad at college. St. Francis University. Where's St. Francis?
Pennsylvania.
Pennsylvania.
It's in heaven.
Got it. So Alicia's been here for a few weeks now.
Archangelo kind of sounds like it.
She's doing a great job. I know, very angelic,
Biblical?
St. Francis.
Archangel.
Anyway, and then Andrew Kirschbaum from Oakland University,
Yep.
which has nothing to do with California.
Not California.
Nothing.
Michigan.
Where's that?
Rochester, Michigan.
Yeah,
Just screws me up, man.
I don't think
Too
so.
many different places.
The Michigan A's.
Something's up, right? Anyway, all right. So what do we have? First question. Who's going to start off? Alicia, what do we got? Take it away.
So squatting with knee pain, quarterbacks and ice for pain. JH from Korea. I have knee pain due to OA. Some say climbing upstairs is good for knee pain. Some say not to do, and squatting is good for knee pain while others not. Which is good for knee pain?
All right. So let's reflect and let's break that down. So knee pain. He has osteoarthritis, and he's confused. Some people say stairs are good. Some people say squatting's good.
Yep.
Is that right? Okay. Knee arthritis. Kind of vague right there. Should people be doing step-ups and squats?
All right. I love this.
This has got Dan Pope
He's
written all over it.
salivating.
This was just a Twitter debate, so I don't know.
Was it really?
Yeah.
Who's debating this?
Kinda.
All right,
All
right, Dan, what do you got, Dan?
I'm gonna take a little more moderate response. I think there's some research to show that things like leg press and squats are good for knee arthritis, right? Something that can be good. The other piece is that if someone hurts like heck squatting, or going up and down stairs, it might not be the best thing to push on your patients, right? Definitely had some patients where it came out, guns a-blazing. Oh, okay, your knees hurt. Well, look, this squat's gonna be great for you. Just have them squat, squat, squat. And either they never come back, or they're like, man, my knees are on fire, and they hurt really bad now. So I think you have to be careful. In general, exercise is good, and if you start looking through the medical literature for exercise and osteoarthritis in the knee, it's all over the place as far as what exercises to use, So I think that you have to take that person into account, how much pain do they have with a squat, how much pain do they have with something like a step up, and then give them exercises based on where they are, pain levels.
Good. I think would you say a moderate or a mid-road response? I think that's actually a good mid-road response. Yeah, you mentioned a little bit in the research. I mean, there's quite a bit of evidence that shows that exercise is effective for osteoarthritis, and of course it is. I mean, it makes total sense. So it sounds like there's good ways and bad ways. Anybody else have anything they want to add?
Yeah, I mean,
Okay.
go ahead, Len.
No, go ahead.
I mean, I just,
They're so polite.
I just think that exercise itself is like, we know it's important, but it's such a nebulous concept for many people who are trying to dose exercise in terms
Did
of
you say
like
nebulous
I did,
concept.
yeah.
So cool.
Yeah,
Love
figure
the
word of the
clouds.
day. Clouds of concepts. Sorry. But I mean, like, there's knee dominant versus like hip dominant versions of a squat. There's there's single leg exercises. There's front loaded, back loaded squats, and I think that kind of building off Dan's point is that communicating with a patient about what types of squats they're maybe doing, or like maybe a step up is not tolerated well. Obviously, if stairs is something they don't do well with, does that mean upstairs, downstairs? downstairs? Does that mean eccentrically loading forward? Does that mean climbing the stairs? There's a lot of versions of exercise that I think Dan has probably had a lot of people who he just tweaked their exercises a little bit and made it more hip dominant and pulled some shearing force off the knee, and they maybe respond great. And I've had the same thing with reverse lunging versus or split squatting in place versus stepping up onto something. So just to think about.
I think people hear exercise too, and especially some docs is still like freak out with certain exercise. They hear exercise and they think like worst case scenario, like it's going to be jumping and running and plyometrics and heavy back squats, when like as PTs and other healthcare professionals, we should be able to tailor it specifically for the person. So, the person has arthritis, and the question, what does that mean? Is it radiographic arthritis, or is it symptomatic swelling, loss of range of motion, pain, loss of function? So there's still, crepitus. It's a very nebulous question.
Nebulous crepitus.
Yeah. So I think there's a lot going on, but obviously exercise, as we know, is.
We need Twitter
Well,
hashtags for these things.
I feel like I had such an important thing to say. And,
Let's move on.
maybe I have a question for the group. So, like, what do you guys think? If you're doing any exercise with knee arthritis and it doesn't hurt while you're doing it, is it bad?
I personally think it's always like a 24-hour window. I think that a lot of people have pain after, because maybe they overdose themselves and they don't really realize that maybe like it's cumulative volume. It's like that plus their daily life is what blows them up. And the next morning,
That's
they're
a
like,
good point.
I have a lot of people, especially with back pain and knee pain. It seems to be, I don't know why, that like the morning after, like they're like, yeah, I was fine during it, but then after I worked out or the next day, I was like awful.
right,
I think I'll be pushing a little bit too much.
I think you just nailed it here. I think that's actually a good answer to my question. Is it's not the exercise necessarily. It was just the added workload to their already workload that makes sense. I think even going back to Dan, like with his response here a little bit, there's no such thing as a bad exercise or a good exercise. It's just one that's most appropriate for you, this person at this time, right? So to say squats are bad, I mean that doesn't even mean anything. We've all talked about it. There's so many different types of squats and different things. There's no reason to say you can't do exercise. First off, then there's no reason you say you can't do a squat. Right, it's too broad, right? Should you do deep loaded back squats? Well, maybe not, right? Maybe yes, to be honest with you. I mean, it's hard to like rule it out, but like I think that's the general point, is we shouldn't be so quick to dismiss everything. There's probably a good way and a bad way, right? Yeah. Makes sense. All right, Andrew, what do we got?
Forrest from Alabama. Hola, mi amigos. What differences in rehab do you usually have when you're rehabbing a shoulder in a baseball player versus a quarterback? I was more of a running back during my time at Alabama, but I was curious about this.
Is this a play on Forrest Gump? Did Forrest Gump go to Alabama?
No.
Didn't he play football somewhere
Was he-
in the movie?
did.
Was it?
I don't know.
Was it Louis LSU or something?
I don't think it was LSU.
Was it Alabama?
According
Might
to
have been
Forrest,
Louisiana,
yeah.
'cause he's from.
I like
I think it's New
the
Orleans, isn't it?
creativity.
Yeah,
That's
I saw his bench. I went to New Orleans and I saw his bench. Or not New Orleans, where was I? Georgia.
You want to start answering the question? All right, so pitcher versus quarterback. Do you do anything different, Len? We can make this one quick, I think.
I mean, they're both throwing, so I honestly, off the top of my head, not a lot. I don't think, because it's still a lot of posterior cuff, maximizing range of motion. I think the throwing versus the baseball versus quarterback motion inherently is slightly different, obviously, and biomechanically, I think they showed that at ASMI. So, but there's still the volume of throwing is gonna be different. There's not as many pitches and all that. But my rehab, so to speak, I don't know. Off the top of my head, I can't think of much. I know we know more about the baseball throwing motion, just the normal range of motion and adaptations that occur. So, it's a similar concept in quarterback.
Yeah, I would say I don't think we necessarily rehab them different. I think our return to play would be different. Obviously, it's a completely different workload. Their injuries are similar, but not quite the same. Baseball tends to be more traumatic blowouts, right? Like your Tommy John's like injured, right? Where football players, since the workload and the stress is a little bit less, like if you especially put it together, they tend to be more sore versus, my UCL needs a Tommy John repair, or reconstruction, for example. So I think it's generally the same, but just when we get to the workloads towards the end, I think it would just vary. So, I think it's about the same. I think that's a good answer. So, good. All right, Alicia, what do we got? Number 3.
Chris from Tampa. Mike, I love the show. I was wondering what you and your crew have to say about using ice as a pain modulator and a method for inflammatory control. I have been doing some searching around, have not found any evidence linking ice to helping reduce inflammation. So so why is it that we use it so often on patients? What do you guys think? When do you use ice?
This is actually a big question.
I just had this conversation.
About ice. We have this question a lot because, yeah, look, it's popular on the internet to be like dramatically on one side of an argument, right? Like to just be like so,
Contrary.
yeah, polar, like you can't ever use ice or something like that, right? So, I mean, how many people here use ice? Right? So we all use ice. Why do we use ice?
I just told the patient yesterday who had like ankle sprain, kind of acute ankle sprain, and it was like the pain is there and it makes you limp and you're kind of walking funny. It's not going to make your injury go away. It's not going to probably, the problem is that it's stagnant blood and you can't get new tissue, in and you can't get blood out. So like it's hard to get like new macronutrients down there. So if you can ice yourself and just walk more smoothly and move around more and tolerate exercise more, then it might be a really good entry into like actually doing stuff. You know what I mean? That's kind of all it came down to. Is like acutely it hurts a lot and like it's really, really sore and maybe that congestion is so painful, but it's not going to be the thing that fixes you. It's going to be the thing that allows you to kind of do more rehab.
There was a study I just put on my Instagram feed at LenMacPT, not to date the episode, but it was recent, that looked at the 2 factors that helped with quadriceps atrophy after an ACL. And the 2 factors were exercise and cryotherapy that actually influenced positively, and there was moderate evidence that showed that cryotherapy and exercise were the 2 things that actually helped return quads after that atrophy that we see all the time. So
Yeah.
you can find research in either way, but this is one research in a very good journal. I forget off the top of my head. It was JOSPT over his AJSM. I tend to hover around those with sports health, but
Yeah.
cryotherapy.
The big argument that many people have is that it's about lymphatic drainage. It's not about true vascular, right? So that like active movement is what allows lymph to be moved because it's a passive system. There's no blood, there's no like vessels. You need calf to like pump out blood from your ankle. I get that, but again, if you can't move and it hurts a ton to like just walk, then it's gonna be really challenging.
Yeah.
There's a good article on my website recently too, around the time of Lenny's Instagram post maybe, but a good friend of ours, Dr. Phil Page, actually wrote a good article about the anti-ice movement, and I think the main point is the anti-ice movement right now online is so that it's all based around inflammation and how inflammation is good for you and we don't want to inhibit that, but you should really read the article because pretty much that whole theory is based on pseudoscience and flawed methodology and a complete lack of scientific evidence in there. It might make sense a little bit theoretically, but there's actually been some research, there's not a ton of research on ice, right? But there's been some research that actually shows that ice helps neuromodulate pain, and ice helps with some of the secondary damage and trauma like that, right? So I think there's even studies that show ice decreases your post-op medication, right? So there's lots of good reasons to use ice. Is it magic? No. Is it evil? Definitely not, right? So if whoever's arguing for either on the internet are probably both wrong, right? But does everybody use ice?
No, it's too nebulous for me.
That's right. I nebulously use ice.
Nebulous crepitus?
I think I gotta look up nebulous.
gotta Google that
and
right
figure out
now.
how to do it. But.
It's a really good incubus song. That's why it's stuck in my head.
Awesome. Thank you, everybody. Another great episode. Head to MikeReinold.com, click on that podcast link, and you can fill out a form, ask us some more great questions, and we'll see you guys on the next episode.